Well, greetings again. This is Dr. Bill Wyatt, and I'm gonna try to go through many things in orthodontics that I've found over the years to be the truth about orthodontics. These things I consider truths, and they'll be correct today. They were correct 15, 20, or 30 years ago when I did many of them, and I think they'll be correct 100 years from now. The same things, and so I'm going to try to cover a lot of these truths in orthodontics. And if you will stick with me through, we'll show all sorts of things that we do in orthodontics that we think is the absolute truth. And if AI wants to use it, that's all right. I'd like to stick my name on it though. So I'm going to start off with rotation of teeth. And that's it goes in two directions. It's not just straight spinning the tooth looking down on it, but there's a whole tooth up here. You can rotate it in this direction in a vertical way, where we'd call that uprighting teeth, but it's really just rotating a tooth. And then the other one would be spinning the tooth like this. So let's get started. I've got a lot of pictures. I'll just run through them real fast, and you can watch it almost like a movie or something like that. Let me get started here. Here is a lady that comes in, and she's got a fairly decent set of teeth. The bite's too deep in here, so you can see right across this area the bite's deep, so we're going to put intruding arches on it, and we'll pick these teeth up, and we'll take the lower teeth that are down here and go down with them, and we'll level this whole thing out. Now if I want to look at it from the side, this is a slightly class 2 problem. Now when we raise these teeth up, and they'll be angled out for the jaw can move forward in here, and actually the 6-year molars should be setting something like this in here. And so we're going to move these teeth further forward and line them up with this, and that's rotating your teeth in a sense, but what we're going to show is how to spin these teeth, or how to pick one of them up that's leaning over. Say if one of these teeth down here is sitting like this, and we would go in and take that tooth and pick it up right here, we would work from the side of it. So I'll call this a vertical rotation, or we refer to it as uprighting teeth, and the other will be just spinning the teeth. Now let's get on to this. We've got a lot to cover. This tooth right here is rotated, I don't think it's 90 degrees, but it's quite a bit of rotation in that tooth. And so we're going to show you the dead cinch way to rotate one. I've never found anything any better than that. On the upper arch, there's a tooth here that, of course, needs to be rotated and brought back in and expand the arch. And if you put the brackets on the teeth correctly, the arch wire will tend to correct all the teeth as far as rotation. Is just the mild rotation. But if you have a rather large rotation in there, then you have to do something better. Now this tooth right here is not 90 degrees, but it's rotated almost straight across here. Now we're going to show you a dead cinch way to rotate this tooth, and it's the best I've ever seen, and I have not found anything better for rotating teeth. And so we'll show you that in how we do it. And it's a cinch thing. Like you hook this elastic chain. I'm going to show you how, and you bring this chain around the tooth, break it down underneath here, and you come over and hook this elastic chain to the bracket right here or whatever you've got on the tooth. As you stretch this out, it's going to pull that tooth toward the arch wire, and then this wrapping it around like this will spin this tooth in this direction. And that is the most efficient way I've found to rotate anybody's tooth. Now, you can do it, you can rotate anybody, any age, at any time during their life, provided it's not ankylosed. Now, if the tooth is ankylosed, that's where the bone is grown into the root of the tooth. You can't rotate it this way unless you break the tooth loose and rotate the bond where the tooth is grown to the bone. There, you have to break that loose, and then you can rotate it. So let's get on here with it. Now here you have to practice a little bit to take this floss and come around, and you put this in dental floss, you pull it underneath here and hook it over here, but not on the arch wire itself. All right, here we go again. Now I'll show you step by step how we do this in just a few minutes. All right, you pull that around, that tooth will spin and it rotates it. I've never found a tooth you could not rotate. And then we've opened the bite, we've run this down like that, and now the jaw can come forward into a class 1 relationship, and we can expand spaces where we need, and where we rotated the tooth correctly, we'll have some extra space there. Now, let's go real quick here, and I'll show this. Now, that tooth was rotated, I think it was on the lower arch. Yeah, it was on the lower arch down in here. We've rotated it correctly. And this tooth is kind of out of place here, where you'd have to get the bracket down in here to bring that around, which would help rotate that molar tooth. Now here, you get a view from the front. You attach the elastic chain about 4 links. You go around the tooth. Now, if the tooth has a kind of a crown that's kind of like this, and you need to put the elastic, you're going to have to put a lump of acrylic on there so that this won't slide over the tooth. And you come across, mash it down through the contact, come over here and hook it here, and this is going to spin that tooth in this direction. And it'll do that on any body that is alive. If your tooth is not ankylosed or having the bone grown to the tooth itself, you have to break that loose, and then you can rotate it. So there it is again. I've got just many pictures. Now right here, we're talking about rotating a tooth that's sitting like this, with the roots down in this area right here, and this is what I call vertical rotation, or uprighting the tooth. It's really just you pick that tooth up. Now, this works just as efficiently as the other one. I've never found a tooth that you couldn't upright. And this is 6-year molars where they're ectopically erupting, or it can be on somebody that comes in with a wisdom tooth that's tilted like that, and you can bond a wire. See, I just bonded a wire on that tooth right there, and I think this shows it a little further, and we make a spring come out of here like that, and now this wire would go way down here, and you're going to have to bring it up and hook it onto a bonded wire on the tooth. Now, so we take a piece of wire and put a little circle and bond it here, put a bond here, put a bond here, and you put some over here. Now your hook would run down here, so you can't hook it up like that, so you have to tie this up so this wire is where you can go in and slip it into this tube. So we put a tube on the side of the tooth. Now this wire here would be down, and we pick it up and we put a hook and hook it on the side right here. And you can do this on, anybody can come in with a tilted tooth and you can upright it. It doesn't, I don't care how old they are, I don't care what race they are or any other thing about the people. This will happen on anybody, anytime during their life, provided it's not ankylosed to that, and you can break it loose and still upright it. Now we'll go on here further. Now that pulls that up, that puts a force on this too. You can bend this wire down more, and it gives it more force. It'll bring it up, and this may run into the teeth up above. Don't grind it off. Just as it bumps this tooth, the chewing will push it down, and the tooth will move on into position like that. Now here we're going to get back to just plain what we call rotation. This other was, we refer to it as a uprighting tooth. It's still a vertical rotation. Now you hook the elastic here. I'm going to go through here in a minute and show you just exactly how to do that. So we take a piece of elastic chain here. Usually you get about 4 of these little deals, and you run some dental floss in through this like that, and now you take this and you take the dental floss, and you've got the 4 deals here, and here's the dental floss. We take that and pull it over the arch wire. Wait just a minute. All right, we take the dental floss. We want to rotate this tooth in this direction. We're going to try to do that. So I'll run the dental floss under here, pull it back up, and we change. This is a different case, but now we take the dental floss is in here. We run it back through the loop there. Now, if you notice, we went under the wire, and we come up over here, and we're going to go through the loop. Now this is as plain as I can get it to show you what you can do here. So we're going to pull that floss through itself. The elastic chain will go in there. As you pull on it further, pull it again, and now it is hooked on there. And now you can go around the tooth. Now this tooth is the one we want to rotate, say, just showing it. We have to put some acrylic here to keep this from sliding up. I'm going to take this, go around, slide the dental floss back in here and pull that over this bracket. And now that's where the trick comes in. Now we go around with the dental floss, slide it through there, and we're going to pull this elastic chain through this tooth, and then we're going to hook it onto the bracket right there. Now there we'll hold this down, and you put some acrylic here, this bond of hump to keep it from sliding over the top. Pull this on through. Now take your floss, run it through that gap. Now you come in on the outside, pull it through. Now you're going to have to run your floss down underneath here and pull it down, because I don't want to hook this on the arch wire. This one is hooked on the arch wire, and that's your dental floss. You're going to run it underneath, and now you've come under. You take it here, you're going in, take the floss through here. Now we've done that. The floss has went through it, coming in here. Now we pull on this and take a pointer and explore something, hook it on the bracket, or whatever you put a hook in there to hook it to. And if you hook that thing onto that, now you can take the floss off, and you leave this circle around here. And you don't have to touch this thing, and this tooth will rotate in this direction. And you will have to when you get it rotated over here, you tie it up into the arch wire, and that'll keep it going, or you take the thing off at that point. Now the hook can run the dental floss under the arch wire now, and this doesn't want to be attached to the arch. You're attached over here. So this pulls the tooth to the wire, and when you come up here, you're going to tie the bracket in. If you put a bracket on it, you can wait and bracket the tooth later, but you got to put a hook on the tooth. All right, we hook the floss on the bracket. There we go, under it again. Just showing you that twice. Now this is hooked here, goes around the tooth, comes over in the bracket, and you put something over here to keep it from sliding off up here. Now here's somebody, we open the bite up, you see on this lady, and we run the arch wire around. Actually, you tie the wire in, rotates a lot of the teeth in there. Now here's another situation, see, so we got this rotated tooth. We put this acrylic back here, and we want to rotate it in this direction right here. So we hook the chain on here, come under, go around, then run the floss under and hook it on the bracket. And this tooth will turn in that direction, and you hook it up. And I've never found a tooth that we couldn't rotate, except the ankylosed one, and you break it loose and you can rotate it too. So we put that on. There's another floss. We cut off about 4 of those deals, run the dental floss between under the arch wire, hook it back over here, pull on it, pulls that up. Here's a little girl. We're putting this chain on the little girl, and we pull it around and lock it like that. Now, this is the tooth we want to rotate. We're going to put the acrylic here to keep that from sliding over, bring it around and hook it on the bracket, but not back on the wire. And this will turn the tooth in that direction. Now here we go around it. We're going to run the dental floss under the wire, come back, hook it up here, and now this tooth, it's like spinning a top in there. Now, to the best of my ability, this is absolute truth. And it was working 20, 30 years ago when I started doing this. However, I wasn't the first person to come up with this idea, but we've been doing it for 20 or 30 or maybe 40 years. We would rotate teeth like that. And there's this, some people say, well, half of what you learn in orthodontics is going to be wrong after so long a time. But this rotation will be correct 100 years from now. You can do that. It's going to be just as up to date and turn the teeth on human beings, or you could even rotate them on an animal if you wanted to. And so you just pull that around, hook it to the bracket, and that's the way we do it. So I'm going to sign off right now, and that is the way to rotate teeth. You can rotate them vertically, or you can spin the tooth like that. Either way. And this is a truth, and I'll stand on that. It is, if anybody's got a better way to rotate it, I would like to know about it. I would like to see it. So thank you for watching, and I'm going to sign out now, and I hope you'll sign up with our channel. Thank you again, and I'll say goodbye.